his 30s, or he's in his 40s. He'd already lost his vision because he'd had 3 or 4 surgeries for this meningioma. I've radiated him. He's about 5 years out, still controlled. So I know that it does work, and it can work. We've done a lot of more older adults with this. The challenge is that it's, everyone's tumor is slightly different. We don't know necessarily that his will be as sensitive as others, but we certainly hope it will be. And at the moment, this is our best option, unfortunately, is the radiation treatment. If we felt surgery was appropriate, we can get it all, or at least the majority, that would probably be the right move. But because of how morbid that would be, you can think of the radiation as the non-invasive version. I can go after all the stuff they can't.
Okay.
Does that make sense?
Yes.
And so I guess from our, I know today's not as positive as I'm sure you've hoped. I think that it's good to have some grounded reality that we are dealing with a very difficult situation that can cause morbidity in his body. But I do think that in an optimistic view, there is a high chance of success with the treatment. Okay? But we also, some of the doom and gloom of it is that there is risk inherent to us treating this area. It is a difficult location, and there is a chance that it won't work. But I don't want that to be what you take away from today. I think it's important you understand that, you get educated on that. We have good solutions down the road if it doesn't work well, or if we run into a major toxicity, we need to be able to work with you to keep your quality of life good and keep him doing well. But I think in reality, I want to try to also focus on that it is very likely that we'll be successful in slowing this down quite a bit and hopefully controlling it for a long time. Because like you saw, we don't really have a lot more time. We can't wait another year or 2 years. It's going to be too big.
Yeah.
Does that make sense? So
yeah.
My hope is we will put a stop to that with this. Okay?
Okay.
Any other questions, guys?
Do you have any questions, Joe? No. Okay.
And the other thing that was somewhat experimental, but this is something that we've been doing here for a few years now, is you had what's called a gallium dotatate PET scan. That is a PET scan that lights up inside tumors that harbor a surface marker called somatostatin receptor. It's a marker that's on most neuroendocrine cancers. It was developed for stomach cancers that are neuroendocrine. So for adults that have stomach cancers, they developed this PET scan specifically for them. It just also turns out that everybody's meningiomas also harbor that same receptor. So it's a great imaging marker for us with meningioma. And like you saw, even for us as trained physicians and our radiologists, it is hard sometimes to know exactly where the tumor starts and stops because there's so much abnormal because of the tumor and because of surgery. What's helpful is, like you see here, the PET scan helps us quite a bit to determine, okay, that's tumor, this is all tumor.
So all the black is tumor?
All the black, yeah.
Sorry.
Well, not this. This is the parotid gland.
Okay.
So what ends up happening is some normal parts, this is why it's important to have both the PET scan and the MRI. There are some normal parts of the body. The parotid gland secretes saliva. So things that secrete, or that's why they're neuroendocrine. So submandibular glands, salivary glands, pituitary gland, they're all going to light up. And they light up because they also have the same receptor. But that doesn't mean it's tumor. This is like a normal piece. All of this stuff shouldn't be there. This should all be lighter gray. All the black here and there in the orbit, all of that is tumor. Does that make sense?
Yeah.
And so with the information we have from the MRI that you had done a few days ago and the PET scan from a few months ago, because even from May to July, there's only just a slight growth. So it's maybe a millimeter or two. So this is still going to be highly accurate. We're going to use both pieces of information to have a lot of certainty that we're not missing tumor. Does that make sense? Because one of the things that we've always dealt with over the decades is there probably were many people that we treated where we just didn't know that that was tumor. And probably undertreated some areas because we thought it was normal bone, or we thought it was surgical related and not tumor. This helps us quite a bit, and I'm glad that we were able to get that with you at Children's because it helps us to make certain we know what we're treating. Does that make sense? So
Yeah.
we'll be more precise, basically, in our ability to treat the tumor. trying our best to keep risk really low in the eye. Once we go through the process of creating a radiation plan, we'll be able to sit down again with you guys and go through in detail and show you exactly where the radiation is. I think pictures usually, or at least are my favorite, to kind of show you things. It's easier to understand than me kind of just blurting it out. We'll kind of show you that where the dose is going on the eye and the nerve to help kind of hammer home what we're doing and hopefully what we're sparing. Okay?
Okay.
Any other questions, guys?
What about that calcium buildup on his stomach?
Calcium buildup where?
Oh yeah, they said that he had on the PET scan, or one of the, I think it's when he had the PET scan, but it was on his stomach. I think I'm gonna have to talk to another doctor probably about that one, which we were worried about.
Let's see what they read in the report. Unfortunately, the PET scan mostly lights up in the brain. So, at least the way they've read it is that there's the left orbital and temporal meningioma. That's kind of the area that I was focusing on the most. That's where your big tumor is. That's where we treat.
Okay.
There's also uptake on the right temporal lobe and left frontal lobe.
Okay.
Bone, excuse me. The right temporal bone is probably like a different meningioma somewhere else that we're just going to watch.
Okay.
Because typically these other areas are likely not. We'll just watch to see if they grow abnormally fast, but if they don't, then we leave them alone.
Okay.
And then there's uptake in the skull base. They call it the clivus. That was that sort of central part between the eyes. There's uptake there as well. There was no other somatostatin disease that they could see in the rest of the body.
Okay.
And so if they told you maybe something at Children's, something about the stomach, I'd probably follow up with them because I'm not sure exactly what that would be about.
Okay.
But at the moment, our hope is we'll focus in on that left orbit, left skull base area, try to control that.
Okay.
The main things I would want you to know is that you'll likely do quite well with the treatment. Acute toxicities that I worry about are just tiredness, maybe some skin reaction over this area and some hair loss. You could develop some irritation or dryness in the eye, or like that early on feels like wetness. It'll just get really moist and teary. You could also get some, it'll feel like you're getting really stuffed up in your nose because we're going to be inflaming kind of in the deep parts of the areas of your sinuses where the tumor is at. So you could feel like a cold type symptoms.
Okay.
Sore throat potentially as well because we're going to be treating right above the mandible. Long term, we always worry about some teeth or tooth decay, so we have to make sure you see dentists and keep the teeth really well managed and clean.
Okay.
Because the actual upper part of the maxilla of your jaw is going to get some radiation dose because you're treating right on top of that or right above it. Other bony areas of the craniofacial, like the outside of the orbits and things like that, might grow slightly slower. So it could just be you may need long term like a plastic surgeon to help fix some asymmetry because it may grow a little bit slower.
Okay.
And then dry eye or damage to the eye or optic area. Damage to the brainstem is also really uncommon, but it's possible. Damage to the brain, unlikely, but possible. And then what we'll have to follow over many years is the pituitary's function, which secretes hormones in his body, helps him grow, helps him use his body function. That can slowly go down over years post-treatment. We'll have to follow for that. The nice thing about that, if you follow it well, you can actually just supplement those medications and then keep the pituitary's function adequate. Okay?
Okay.
So those are the key things. Would you guys be okay proceeding with the mask-making procedure and treatment after hearing all of that?
Yes.
What are your thoughts?
Yes.
Okay. And so today we're going to be making a mask that fits over the head and the shoulders. It's going to be like a warm washcloth, but it's tight. So just so we'll kind of walk you through it because the key is that we want it to be tight so it's precise so we know we're hitting the right places and not the wrong places, but know that it's going to mold exactly to you And the key is it takes about 30 minutes, like making a cast. If you've ever seen someone in the cast, it takes a little bit of time for that to actually harden because it's going to come out kind of hot and moist, and then it will slowly cool and form to exactly you. Once we do that, we do a quick scan of the head, and we can make it into anything you want. So if you have like a superhero, we can make like this head and neck bust into anything that you'd like. So it kind of looks like that head only one, and then we can make it into a design. If you have any artistic things that you want us to do, we can create whatever you would like. Do you have any sort of character or superhero that you really like that you'd like to take home?
Who do you like as a superhero?
No one.
What about any cartoons or shows that you watch that you really like?
I don't know.
Well, we can have you think about it with each other, and let us know what you'd like, and we can make it anything.
What kind of stuff's on your Fortnite? That's his favorite, but I have no idea.
We've definitely made Fortnite characters in the past. That is a highly sought after artistic one. Do you have like a favorite character?
I have a lot of favorite characters.
Well, name one.
Which one's
Name
your?
some.
Which one would you like us? Don't choose something too hard, but if you want to, you can. We'll love the challenge.
Gotta think.
Yeah, think about it. You got some time. So when we start making the mask, and once we're done with it, just let us know if you have one that you really like to see if we can make it. We can try to make it just for you. Okay? Try to personalize this whole thing. Anything else that you guys have questions on? Logistics, treatment, side effects, anything else about the tumor, or anything else that you were thinking about? Today will hopefully be the longest kind of education day, but we do want to continue that education long term.
Okay.
So that way you guys always get the information that you want or need. And we also want you, Jason, to be able to be comfortable and ready to go. We want to make this better for you. Okay? You're at the center of all of this. Anything else you guys need? Okay. So let me touch base with our team, see if they're ready to start making the mask.
Okay.
If anything else comes up, you know you can always contact me or Kayla. We are always here all the time. You can text, call, send in my charts, whatever you need.
Okay.
We want to make certain things go really well for you. You ready, Jason? You mind if I do a real quick exam? You want to let Kayla know?
Yeah, sure.
Lean forward towards me. I want to see the eyes. Look up right here. Follow my fingers with me. Down, good. Now looking right here, I'm going to move my finger around. Tell me if you see one finger or two. You see one or two?
One.
Do you ever get double vision at any part of your vision here? Or not really? So if you follow my fingers all the way to the left, it still looks like one? Looks like one? Here one? Here one? That is really good. Because sometimes when the eye is impacted like this, sometimes you can see two of things, but it sounds like you don't have that, right?
He has double vision sometimes.
So
He
it's
doesn't have it.
intermittent, not-
Yes, it's not all the time.
Good. Because that's the double vision is that, if you remember, that nerve that runs through the deep part of the brain, there is tumor in that location. Usually if the tumor is causing it, it would be all the time. Intermittent means maybe it's getting injured or pressed on, but hopefully if we stop its growth, we won't see that.
Okay.
Because obviously we want you to have good vision, okay? Can you pull the mask down for me? Any numbness on the face here? No? Smile really big, eyebrows up, close your eyes tight. So there is some limitation there.
That,
Stick your tongue out. Go
are
ahead.
you talking about the eyebrow? That's been there ever since
The
he's
surgery?
had the surgery.
So they might have hit that nerve maybe.
Yes, that's what they were thinking.
Yeah. Stick your tongue out. Good. I think you're doing awesome, okay? We're going to try to make this tumor better for you, okay? One day at a time. All right. I'll grab these guys.
So it's not gonna hurt, right?
The mask doesn't hurt, but it's tight. So some people, if you get really kind of anxious with tight spaces, sometimes that can be a problem. But if you did your MRI, it's like the MRI. It's going to be just tight around your head. Usually, if you do well with the MRI, then you do really well with the mask.
So
It shouldn't hurt you.
Is it gonna touch my face at all?
It does touch your face. It's like a warm washcloth. So I think of it as it's kind of a holy washcloth because it comes out as this kind of warm plastic material. it touches your face because it's going to conform to your exact facial structure. And so they will take it and pull it over you. You can see and breathe through it the whole time. That's why the holes are there. So you can breathe through your nose, you can breathe through your mouth, you can open your eyes. Most people, and I would recommend you keep your eyes closed while they're putting it on, but then you can open them. Because what will happen is if you